January 23rd is Maternal Health Day, and this year's theme is to understand the underlying causes of maternal deaths.
Dr. Wendy McDonald joins us now with more. And we were just talking in the break, the rate of mortality, morbidity in the U.S. is astounding for a developed nation.
Yeah, so let's talk about the actual numbers because I think it's important for perspective. In the U.S., 24 out of 100,000 women die as related to complications related to childbirth, which is about 2 to 3 times more than any other developed country, high-income country in the world. So it's really high, but it's also 24 in 100,000, which is less than 0.1%. And I think that's important for perspective because as we highlight these differences and the importance of attention to Black maternal health and just maternal health rate in general, we need to also not be afraid that you're going to walk in the room and like drop dead. You know what I mean? Because that can add to our fears and our anxiety as well.
Which impacts the actual pregnancy itself. But a lot of this can be prevented if attention is paid in the beginning, the early stages, before and during the pregnancy.
Absolutely. So something like, you know, let's talk about also what people are dying from. It's complications related to heart disease, it's complications related to diabetes, blood clots. We know Serena Williams had a blood clot that was, was delayed in diagnosis. These are things that are actually leading to these deaths. But something like caring for our heart health and our general health before pregnancy can reduce that risk. Something as small as a 10% reduction in our pre-pregnancy weight is going to change our outcome risk substantially. Coming into a pregnancy with normal blood pressure, but how many people know even what a normal blood pressure is?
They don't.
Do you know?
Like, how often do you get it checked?
Like once a year, and it can change a lot in a short period of time.
It certainly can. So something like knowing that a normal blood pressure pre-pregnancy is actually below 130 over 80. So we think of 140 over 90 as high blood pressure, which is the technical diagnosis in pregnancy, but even above 130 over 80 prior to pregnancy is considered high. And if we don't know that and can't kind of like try to reduce that risk, then we do start off the pregnancy with a little bit of higher risk of those complications.
So is it up to the woman to be getting those physicals right before she starts the attempt to getting pregnant?
Ideally, yes. Ideally, yes. And then I think within the pregnancy, say you don't do that. Say you just, become pregnant. I hate the term fall pregnant. You hear people say that.
Like, how do you fall pregnant? Maybe he fell.
Exactly. But so when you become pregnant, knowing when you go into that prenatal visit what your blood pressure is important. And understanding that one high blood pressure doesn't make a person hypertensive. Hypertension is like a diagnosis, right? So you can have a high blood pressure and then repeat the blood pressure and it be normal and then not have to worry necessarily. But following that throughout the pregnancy, because pregnancy can change us. It changes us in so many ways as we become parents. But it can change our internal organs. And so you can find yourself at, say, 24, 26 weeks having a blood pressure that you've never had before. Well, now we should know that. And then hopefully monitor that really closely with your OB provider. Maybe monitor it at home. I have people checking their blood pressure at home and logging it and calling in with those blood pressures. This is important.
Yeah, this is important. What are some of the symptoms or signs at home that you can experience that says, hey, you know what, I need to call my doctor?
Let's generalize and say anything that doesn't go away. Because I can tell you headaches that don't go away, or shortness of breath, or chest pain that won't go away, or that keeps happening. Like every time I do this, this happens. That's worth checking in with your provider. And I don't even know that I have a full scope of everything that can happen symptom-wise, but if it keeps happening, it's worth checking in. It's worth calling. And if you call, this is where advocating for yourself comes into play, right? If you call and your provider's like, oh, it's probably okay. And then you may take that advice and things seem to be okay. And then it happens again. Call again. Because wait, is it okay? Am I safe? Is this something that needs to be monitored further?
And so when you're talking about headache and different things, what are the underlying conditions that could be causing that?
Preeclampsia is a big one. Preeclampsia is a big one. It is a syndrome that causes high blood pressure. It can cause changes to multiple organs, including your liver, your kidneys, your brain. And so some of the symptoms of that are headaches, vision changes, abdominal pain that won't go away. Now, all of those things can happen intermittently in pregnancy, right? But if they keep happening, or again, if you check your blood pressure and now it's 140 over 95 and it's never been that high, we need to evaluate and make sure you don't have preeclampsia, because preeclampsia can lead to life-threatening complications for mom and baby.
Which is why it's so important to keep up with your doctor visits, because they're on a schedule pretty much. Once you're I shouldn't say diagnosed as pregnant, but once you're determined to be pregnant. So a lot of people are probably freaking out. There's more information on your website, Instagram, drewoman.com.
pregnancy guide that's downloadable, correct?
Yes, there's a pregnancy guide as well that just teaches people about those symptoms that they can be looking out for.
Yeah, because I assume, not assume, I remember, during pregnancy, things also change that start to happen. You get the heartburn and all that kind of stuff, but you have to be aware of what could happen and what it could possibly be.
Exactly.
Yeah, keep a log, because sometimes you'll forget about it. So write it down. Come on, I used to have lists for questions I needed to ask my doctor.
Some doctors don't love lists. I love lists. I would love to know what's happening specifically.
That's good to know.
Well, Dr. Wendy, thank you as always.
Thank you.
Here's our information there. The website, dreverywoman.com, or loopobgyn also .com, but dreverywoman.com, as well as her social media handles. Thank you.